Do you have kidney disease and have trouble getting to sleep and staying asleep the entire night? Well, I'm going to talk about the 4 common causes and what I've done to overcome them coming right up. Hello, warriors. James here, your favorite kidney health coach. And it is common for those of us with chronic kidney disease to have problems falling asleep and staying asleep. Getting a full night's sleep is, something we dearly miss. Now, before I get into the 4 common causes and what I've done to overcome them, don't forget to subscribe to my YouTube channel, youtube.com/DadviceTV, and click the little bell icon. That way you'll get a notification every time I upload something new. And now to today's topic. So as I mentioned, it is very common, and you guys know firsthand, getting a full night's sleep can be challenging, extremely challenging, almost impossible feeling when you have chronic kidney disease. Now, when I was first diagnosed, I had trouble sleeping for months actually before I ended up in the hospital and being diagnosed. And until about probably 6 weeks ago, it was still difficult to get a good night's sleep. I may go to bed and fall asleep fine, or maybe I take a little melatonin to help me fall asleep, but I was waking up usually just a couple hours later, and I just could not fall asleep for another 3, 4, 5 hours. And that made it really difficult to be myself the next day and to help my body fight the chronic kidney disease and get better. So let's take a look at the 4 common causes of this in today's video. Number 1, restless leg syndrome. This is quite common. What happens is whether you're laying down or you're sitting up, your legs just, they're not comfortable. They don't feel right. Could be itching, could be pain, could just be, there's just something wrong, and you gotta keep moving them around. And that keeps you up all night. Sometimes people even get like a massager, run it on their legs. Okay, now you're disturbing whoever's laying in bed next to you, and just the effort of doing that, and it's a pain in the butt. Now, the good news is doctors have found out that the most common cause of restless leg syndrome is an iron deficiency. Ooh, sound familiar with kidney disease? Iron deficiency. Also, it could be caffeine, alcohol, tobacco. I hope you're not using tobacco if you have chronic kidney disease. Could also be from diabetes or some medications that you're taking. So it's important, if you do suffer from restless leg syndrome, talk to your doctor about it to find out what you can do to alleviate that problem. Number 2 is sleep apnea. Now, sleep apnea is when you stop breathing, usually for about 10 seconds. That time when you're not sleeping, it's called an apnea. Now, people who suffer from sleep apnea usually have horrible snoring. My wife can tell you all about that. I suffered from sleep apnea. And you're just, you're going to bed, you're trying to sleep, you're snoring a lot. That's not helping you get good deep sleep. Then you stop breathing. Then all of a sudden, about 10 seconds later, you're snorting, you're going back at it, snoring as you catch your breath and keep going. It's not good for your body. It's not comfortable, and it could be dangerous. Now, the only way to really determine if you have sleep apnea is to talk to your doctor. They can do some tests. It may involve a sleepover at some kind of a center where they watch you sleep and they check what's happening with your breathing. The most common treatment, and your doctor can determine what the right treatment for you is, a machine that helps you sleep. I did not use a machine, and I no longer suffer from sleep apnea. We'll get to that in just a few moments. Number 3, high toxin levels in your blood. Now, for those of us with chronic kidney disease, this is the number 1 cause. When I talk to doctors, they say, yep, that's your first thing you got to check for. And then there's these other problems. But your kidneys, they're not functioning like a healthy kidney would. And when you're eating, even though you stick with your renal diet and you're not cheating, it still takes a long time for your body to catch up with the food that you ate that then flushed your system full of all sorts of things. And then also your body's creating waste and toxins all the time, just doing the stuff that it does. When those levels get too high, you're going to have trouble either falling asleep and or staying asleep. And number 4 is emotions. With chronic kidney disease, it's tough on you both physically and mentally. You've got all sorts of concerns, worry, sadness, depression. You're dealing with a lot. And that can weigh on your ability to get some good sleep at night. Now, if you're suffering from depression, you feel sad for 2 weeks or longer, talk to your healthcare team. They will help you find methods to overcome those. All right. And for me, it was a lot in the beginning. I felt, oh no, what am I going to be able to do? My life has just changed. And one of the outlets my doctor recommended was find something you enjoy. And I enjoy sharing. I enjoy talking to people. And that's these videos right here. This is one of my outlets. It makes me feel really productive. Now, I'm still going to work. I still have my full-time job. But this helps me share my story, talk about it, get it off my shoulders so I'm not alone. And it's helping a lot of you by showing you that, hey, you can fight kidney disease. You can do more than just coast on down till you need dialysis. So that was number 4, the emotions. So what did I do to overcome these and get a great night's sleep? Well, it started about 4.5 weeks ago. And it involved when I eat, what I eat, and this is going to sound odd, but when I don't eat. Those 3 things together made a huge impact on my sleep pattern. And let me tell you how I did it. So first of all, let's talk about when I eat. I do intermittent fasting. I wish I would have done this day 1 instead of waiting 5 months into this to start doing that. The benefits for me have been great. It's helped me with weight loss, but it's really helped me with sleeping all night. Just to make it clear, I go to bed and then I wake up in the morning. Some nights I might get up once just to go to the bathroom, but I come back to bed, I fall right asleep, and I am sound asleep the rest of the night. I am rested. I feel fantastic, okay? So my first meal, I personally try not to eat until noon. Now, my window working with my dietitian is I can eat my first meal at 10 a.m., but I try to push it to noon. I eat my first meal at noon. I eat my last meal. I finish it 6 p.m. I usually start making it at 5, finish it at 6 p.m. From 6 p.m. through the night while I'm sleeping, getting the great night's sleep, and through the next morning, I'm only drinking water. No snacking, no cheating. Okay, it's really important if you're going to do this that you don't cheat, because then it's not effective. So I'm doing this intermittent fasting. Also, when I eat early in the morning, that's when I have my carbs for the day, my sugar, because it's going to spike your insulin levels. It's going to cause all sorts of issues, and you don't want those happening when you're getting ready to go to bed or when you're trying to sleep. You want your insulin to be more balanced throughout the evening for you and throughout the night. So I'm eating my carbs earlier in the day. I'm eating a lower carb diet, a very low carb diet as a matter of fact. And then when it comes to dinner time, I'm loading up on the fats. Now you're going to think fat is bad for you. No, some fats are. Too much of some fats are bad, but fat is not bad for you. It's one of the 3 things your body can burn for energy. You can burn carbs, which we don't want to give too much of those. I can burn fat, or I can burn protein. I'm not burning protein, okay? Got to protect that, keep my protein in my body, keep it in my muscles. So I'm eating good fats, heavier at my dinner. So it's a much heavier percentage of fat, then followed by protein, a moderate amount of protein, and then very, very little carbs in my last meal. Now, in that little window between my first meal and my last meal, personally, I've gotten to where I'm just eating 2 meals. I pretty much eat what you would consider lunch, but your first meal of the day, and I eat dinner, and I have a snack, a small, healthy snack somewhere there in the middle. But only eating then has really, really made a huge impact on my body. And let's look at how this addresses the issues that we just talked about. We're going to skip over the restless legs. I'll come back to that one. Too much toxins in my blood. Well, now by stopping at 6 o'clock, my digestive system's still going to run for a few hours, filling my body with nutrients and all sorts of stuff. My body's still doing what it does. It's still making toxins, still making waste products, but my kidneys have a break from 6 p.m. until my system starts back up the next day, where there's a lot less that they have to keep up with. They can catch up with me. Remember, your kidneys are still working. They're just working at a much lower percentage, so it's going to take them more time. I'm giving them more time by not giving a pounding, by constant snacking and feeding more stuff into them that they got to work on. I'm allowing them to do their job, and I'm kind of working around their schedule is how I see it. So they're doing the great job at getting the waste and the toxins down in my body, which addresses that concern. When it comes to sleep apnea, I have no clue why this happened, but it completely went away. Now, it may be because I've addressed the other issues and I'm able to get to a deeper sleep. I don't know, but my sleep apnea problem has gone away. I'm no longer snoring. I'm going to bed, I'm falling asleep, and I'm sleeping through the night. Now, my restless leg syndrome, I definitely had an iron deficiency like so many people, and it's hard to get iron. Some people end up needing an infusion of iron, but my dietitian and my doctor recommended these Pro-Renal Plus D multivitamins. I've talked about them before. National Kidney Foundation right here on them. A lot of the dialysis centers recommend these for patients. These are good for anyone with kidney disease, stage 1 through stage 5, even those on dialysis. Do not go start taking them on your own. Ask your doctor, ask your dietitian if this is right for you. If they say yeah, you can order these on Amazon. This is 60-day supply, which also has my omega-3 in it. You can get it with or without omega-3. But 2 of these little tablets, you can't see it here, but that's nearly half, 44% of the iron that I need. So all of a sudden I'm getting my iron. I've got these, I've got my diet, and my restless leg syndrome gone. Now I don't have diabetes. I don't have any medications that are causing restless leg syndrome. Mine was caused by the iron deficiency. Got it taken care of with my multivitamin that I take every morning. And then last, my emotions, the stress. I have exercises I do, mental exercises, things that I do to try to relieve the emotional stress, the burden, the concerns that I have. You know, it's not easy to explain. My doctor recommended find an outlet, find something you like to do, a great hobby. I love sharing, I love talking to people. I am a people person. I do these videos right here. This is a great outlet for me. I also, later in the day, I'm not going on Facebook into the groups, seeing, challenges that other people are facing, or someone talking about, they're going to have to get on dialysis. They don't know what they'll do because they love eating Big Macs every day. I honestly see things like this, and that it would keep me concerned, like, oh no, do they know what they're doing? The diet, it's really, really important. I just stay away from all that stuff late in the day, so I don't have any of that on my mind. I focus on the positives. I focus on the accomplishments I've made. I focus on the future, the accomplishments I want to do, the milestones in my program to continue to fight and beat kidney disease. So if I've addressed all 4 of the issues that are very common for robbing us of a great night's sleep. And for about 4.5 weeks now, I have gone to bed and had a fantastic, amazing night's sleep. Yeah, I just can't remind you guys how great it is to do that over and over and over again, to have that consistency of going to bed, getting a great night's sleep, and then waking up energized, ready for the world. All right, so I encourage you, talk to your doctor. You heard about the 4 common things. You heard what I did. Ask them, are those right for you? What should you do to address those problems? Don't be afraid to communicate with your health team. They need to know about the concerns you have, about the challenges you have, so they can help you to overcome them. All right, if you haven't subscribed, don't forget, I'm gonna plug it one more time. Please subscribe to my YouTube channel, youtube.com/DadviceTV, and click the little bell icon so you'll get a notification every time I upload something new. And share these videos. If you know someone who needs to be inspired, who needs to know there may be a chance for you to get better, give them some hope. Share my videos with them. Now, not everyone can do what I've done and go from stage 5 to stage 3 in just 6 months and continue to get better, but it's worth trying. Don't give in to, you just got to go through and keep getting worse and eventually go on dialysis. Talk to your doctors, push your doctors to make a program to help you get better, and set milestones every month where you're going to be so you can check in with them. Don't settle for, I'm going to give you some blood work, I'll eat better, I'll see you in a year. That is not how you get better. You got to work with your doctors. You got to have communication, and they love that. They get so many patients that don't listen, that don't want to know, that don't really follow their advice. They've got a lot of education, they've got a lot of experience. Push them, let them know that you want to hear their advice. You want to hear their recommendations. You want to check in often. You want to get better. And that's your best way to find a path to get better. All right, you can learn more about what I've done on my website, dadvicetv.com, but YouTube is by far the best way to stay up to date with the latest and greatest. Thanks for watching. I'll see you in the next video.